Did you know that prostate cancer is one of the most serious types of cancer men can encounter? According to leading health organizations, it's the second most commonly diagnosed cancer in men after skin cancer. Around 1 in 8 men are likely to hear this diagnosis at some point in their lives. Each year, a significant number of new cases appear in the United States, and many men tragically lose their battle with it. The encouraging news is that if prostate cancer is detected and treated early, the chances of it being life-threatening go way down. That's why it's so important for men to catch the early warning signs. What you need to know about prostate cancer. A lot of men don't really pay attention to their prostate until something goes wrong. This small gland, tucked just beneath the bladder and wrapped around the urethra, produces seminal fluid. That fluid helps transport male reproductive cells out of the body and plays a big part in fertility. Most prostate cancers are labeled as adenocarcinomas, meaning they come from the gland cells. In general, these cancers fall into 2 categories: fast-growing cancers which spread quickly and can be much more serious, and slow-growing cancers that may go unnoticed for a long time and might not even cause symptoms initially. Even though some men can live for many years without ever realizing they have a slow-growing form of prostate cancer, the disease becomes much more concerning once it spreads to other parts of the body. That's why regular prostate checkups are key, even when you feel perfectly fine. Early detection can truly save your life. Before we get into the major warning signs, be sure to like this video and subscribe to our channel if you want more health insights. Now, let's look at the signs. Number 1. Painful or burning urination. Do you experience discomfort or a burning feeling when you pee? As cancer causes the prostate gland to enlarge, it can obstruct urine flow. This blockage often creates pain or a burning sensation. Prostate cancer may also grow into nearby structures, including the urethra, bladder, or rectum, which can worsen that pain. Sometimes, urinary tract infections triggered by retained urine can make it burn when you pee. While antibiotics might offer some quick relief, the real problem, possibly prostate cancer, needs a professional's attention. Also, factors like family history, genetics, obesity, and lifestyle can amplify these symptoms. Number 2. Frequent nocturia and urination. Do you keep getting up in the middle of the night to use the bathroom? If so, you might be dealing with nocturia, or frequent nighttime urination, and this could be a warning. Your sleep can really suffer when you're constantly waking up to pee, leaving you drained during the day. If you're noticing this pattern, it's wise to have a chat with your doctor. Tracking how often it happens in a bladder diary can help you and your healthcare provider figure out the severity of the problem. Number 3. Blood in the urine. If you ever see blood in your urine, a symptom that is also known as hematuria, you should take measures as that shows up in later stages of prostate cancer. Hematuria can be split into 2 main forms: microscopic hematuria, where blood can't be seen with the naked eye and only appears under a microscope, and macroscopic hematuria, when blood is clearly visible in the urine, appearing red or pinkish. Although only a small percentage of men with prostate cancer may notice red or pink urine, it's definitely a warning that something could be affecting the kidneys, ureters, bladder, or other parts of the urinary system. Getting regular urine tests and a thorough medical checkup is essential if you see any sign of blood. Sign number 4. Pain in your back, hips, or legs. Think about it. Are you bothered by a consistent ache in any of those areas? When prostate cancer moves into the bones, it can produce a deep, lingering pain in these spots. Researchers have found that men with unexplained back pain have a greater chance of discovering they have prostate cancer. More advanced forms may even create weakness or numbness in the limbs. If your lower back or hips keep hurting for no clear reason, make sure to consult a doctor without delay. Sign number 5. Sudden weight loss. Have you been shedding pounds unexpectedly, even though you haven't altered your eating or exercise habits? Sudden weight loss is a known sign of many cancers, including prostate cancer. Because cancer cells consume a lot of energy, they can interfere with your body's normal functions, leading to issues like tiredness, a shifting appetite, and even nausea. Don't see surprise weight loss as purely a good thing. It might be a signal that something deeper is going on. Seek medical advice to get to the bottom of it. Sign number 6. Pain in the rectum. Are you noticing any pain or discomfort in the rectal area? If prostate cancer grows toward the rectum, you might encounter pain, problems with bowel movements, unexpected urgency, leaks, gas, partial blockages, diarrhea, or other changes in how your bowels work. It's never a good idea to ignore these red flags. A thorough exam by a healthcare provider, which could include a digital rectal exam, an ultrasound, or a PSA test, can help confirm what's truly happening. Sign number 7. Pain while sitting. Does it hurt to sit for an extended period, especially on harder surfaces? When the prostate gland is bigger because of cancer, staying seated can become uncomfortable. Pain or numbness in the area between the genitals and the anus, the perineum, could be another warning sign. If simple sitting starts triggering pelvic or lower back pain, you need a professional evaluation as soon as possible. Sign number 8. Problems urinating. Prostate cancer may lead to retention of urine, making it tough to empty your bladder. This is typically caused by the tumor's local spread along with the prostate's swelling. Don't ignore this. Book an appointment with a urologist if you're struggling to pee normally. Sign number 9. Loss of bladder control. Have you found yourself involuntarily leaking urine or struggling to hold it in until you can find a restroom? Urinary incontinence might be an early clue pointing toward prostate cancer, or it could be a result of treatments like surgery or radiation therapy. Since the prostate plays a part in managing urine flow, any damage from cancer cells or from medical intervention can affect the nerves that help you control your bladder. In fact, a notable portion of men deal with bladder control challenges once treatment is complete. Sign number 10. Painful ejaculation. Painful ejaculation might be more than just a small annoyance. It can signal a deeper problem with your prostate. The pain may feel sharp in the penis, or like a dull ache in the testes, rectum, or lower abdomen. It might be mild for some men but severe and long-lasting for others. Either way, don't brush it off. If you keep experiencing painful climax, you should see a healthcare professional right away. Getting help early can head off more serious complications in the future. Experts still don't know precisely what makes these cells turn cancerous, but here's the basic idea. Much like with other types of cancer, prostate cancer starts when certain cells begin dividing way faster than they're supposed to. Instead of going through their natural cycle of growth and death, these cells keep building up. As they multiply, they form a lump known as a tumor. Eventually, pieces of the tumor may break away and travel to other parts of your body, which is called metastasis. The positive news is that a large number of prostate cancers grow slowly, and doctors often catch them before they've spread beyond the prostate itself. When detected at this early stage, there are lots of highly effective treatments that can give you an excellent shot at recovery. How do you actually prevent prostate cancer? Well, one big step is focusing on a healthy diet. That means loading up on fruits, veggies, and whole grains. Another tip is to skip the supplements. There's really no solid proof that they lower your prostate cancer risk. Also, try to work out regularly. Even doing some form of exercise 3 times a week can really boost both your physical and mental health. Keep an eye on your weight, too. If you need to lose a few pounds, do it gradually with a balanced diet and steady exercise. Finally, have a chat with your doctor about your risk factors. In some cases, medications like finasteride or dutasteride might help, but it's always important to understand the possible side effects before deciding on anything. Prostate cancer has a high rate of successful treatment, particularly when detected early on. Don't panic or assume the worst, but do seek medical attention if you recognize any of these early signs. If you got something useful from this information, make sure to like, subscribe, and share it with anyone else who might gain from it. And if you have personal experiences or thoughts, drop them in the comments. We'd love to hear from you. Until next time, take care of yourself and stay informed.